Hi everyone. So today's topic is on the condition known as hand, foot and mouth disease. Hand, foot and mouth disease is an infectious disease causing a rash on hands, feet and mouth. So that is we call it hand, foot and mouth disease, HFMD. This is a viral infection most commonly caused by the virus known as Coxsackie virus A type 16. This hand-foot-mouth disease, it affects most commonly children and especially very young children under age of 5 to 10. But it can also affect adults also. But children are the most commonly affected group of individuals in hand, foot and mouth disease. So we are going to see a lot of cases of hand, foot, mouth disease are going to be in daycare, summer camps and within families. There is going to be called horizontal transmission, that is transmission between children to children. And we see increased number of hand, foot, mouth disease cases, especially in the late summer. Viruses that cause hand, foot, mouth disease are going to be transmitted by bodily fluids. So it's going to occur via contact with bodily fluids, either from oral secretions or nasal secretions or from fecal material, and we can also see it from respiratory droplets that become aerosolized, and all of this can occur via direct or indirect mechanism. So direct meaning that if one child is infected, can directly transmit the virus to another child. That the children get in contact with the respiratory or oral mucosa and get infected directly from other infected child. Or it could be indirect, meaning that there is an infected child that touches the object in the environment. That could be furniture, toys. They live in the environment and another child comes into contact with that droplets touching the same furniture or toys and gets infected. Important point to be noted in this is that when an individual becomes infected with this virus, it takes about 3 to 5 days before patient starts to see the symptoms. That is what incubation period. Now let's understand what are the clinical features of hand, foot and mouth disease, that is signs and symptoms. The most hallmark feature of characteristic symptom of hand, foot, mouth disease is rash. Before that, there are signs and symptoms that are going to include the following: a fever. So a fever that's going to be anywhere from 38 to 39 degrees Celsius. It's going to be a low grade fever that occurs for about 24 to 48 hours. Patients can also have a sore mouth and sore throat. And there is a reduced appetite. Patients may have malaise. They can feel generally weakness, unwell. Some patients may also complain of abdominal pain and can some even have nausea and vomiting. So after the 12 to 36 hours of fever and other symptoms, we start to see an eruption of a vesicular rash. So the rash could be like blister-like sores on the hands and feet and mouth, and especially in the mouth region. The rash is going to be like vesicles and pustules on erythematous base. So vesicles are going to be fluid filled raised. Pustules are pus filled lesions. Erythematous means the skin is red. So we can see the rash occurring inside the mouth. So we can see it on the tongue, around the buccal mucosa and hard palate buccal mucosa, and insides of the cheek or on hard power. It's going to be upper top of the mouth. So we are going to see the rash occur first inside the mouth, and then it's going to be start on other parts of the body like hands and feet. The hand and foot rash lasts for around 5 to 10 days. Other parts of the body that are affected with this rash include not only the mouth, hands and feet, but I can also see this rash on the posterior mouth, hands, feet, buttocks and genitalia. So let's see the diagnosis of handful mouth disease. Oftentimes it's going to be a clinical diagnosis by history and physical examination. But laboratory investigations may be used in some cases. This may include viral isolation using 2 swabs, PCR, serological testing like antibodies. So coming to treatment, it is often going to be a supportive. It's going to be self-limiting within 7 to 10 days. It often resolves on its own within 7 to 10 days. So supportive treatment is often going to be with the fluids. So giving the patient lots of fluid. And in homeopathy treatment, Homeopathy medicines improve immunity. It relieves fever, pain, and other complaints. It treats the person as a whole. Treatment is constitutional. Some of the homeopathy medicines that can be used for treatment of hand, foot, and mouth disease are Apis mellifica, second is Carboaluminalis, Rustox, and Spigelia. So I hope you find this topic helpful. If you did it, please like and subscribe to my channel and support me. And do share this video with your relatives and friends. Thank you so much for watching. See you in the next video.